Hi, my name is Brad, and I shouldn't be here. On April 30th, 2016, I suffered a life-threatening blood clot in my right leg. That blood clot could have easily gone to my head, my heart, my lungs, some other organ, in which case I'd probably be dead or not speaking clearly. I was told I've been very lucky that all it did was cause 30 minutes of excruciating pain in my right leg. The cause of my blood clots was atrial flutter. That's where your upper valves, or the atrials, beat much faster than your lower valves, or ventricles, and your heart is simply not working like it used to. It might only work at 25 or 50% of what it was doing prior to having atrial flutter. This means the blood pools in your heart, coagulates, and clots. And for me, it sent out a really big clot on April 30th, directly to my right leg. Felt like a leg cramp, but it just would not go away. Turns out I'd had symptoms of atrial flutter for years. What are the symptoms? Well, one of them is palpitations, heart palpitations. In 2008, I was living in South Florida, and I really loved cycling. And it was nothing for me to go out and spend 2.5 hours riding around in South Florida in 90-degree heat and 90-degree humidity. The palpitations would show up for a few seconds. My heart or chest would grumble or rumble, and then it would disappear. I figured no big deal. It was just a really hot day, and I was getting older. I was 44 at the time. I was about 30 pounds overweight, so I figured all of these factors together caused a little stress in my heart. The next year, in 2009, my stamina really dropped. I also liked running, and I couldn't run anymore. Whereas before I could run 3 or 4 miles at a time with no problems, now I could barely make it a half mile before I had to stop and catch my breath. Didn't pay it much mind. Why? Because after 3 or 4 days of consistent running or exercise, my stamina would return and I could run 2 or 3 miles at a shot, which I was happy with, and everything was fine. Then in 2015, October of 2015, my stamina went to 0. I could not run more than 50 or 100 feet without having to stop and catch my breath. Again, I figured I was older, 51 at the time. I figured I was 30 pounds overweight, and I also drank a little too much wine, beer, and whiskey. So between a poor diet, stress at work, not able to be in exercise enough, and just being that much older, of course my stamina would be 0. And after a couple days of regular exercise, stamina would be good enough to where I could run 2 miles or so and get my exercise in. So I didn't think anything of it. Then, in February of 2016, I started experiencing shortness of breath. I would wake up after 5 or 6 hours of sleep, gasping for air, trying to breathe. Once again, I ignored it. I didn't give it any mind because I figured I needed a new pillow. I figured I was under a lot of stress at work. As you get older, you don't require that much sleep as you do when you were younger. All these things I told myself, trying to convince myself that I was still a healthy, active, viable person. I was wrong. Okay? All of these things were a sign of atrial flutter or atrial fibrillation, and my heart just was not working as strong as it used to. It maybe only worked at 25 or 50% of what it normally did just a few years earlier. So by working harder or exercising more, trying to strengthen the heart, I was actually doing more damage to it. I was trying to get a heart that was working at 25-50% of its full capacity and trying to make it work at 100%. That actually caused more damage and probably led, again, to the blood clots in my heart. This all could have been solved rather easily with a doctor's visit once a year, but since I hated going to the doctor, I simply didn't do it. Now, once a week, I have to go in and get my blood checked to see if the amount of warfarin, the blood thinner I'm taking every month, is doing any good. And every month now I have to go in and see a cardiologist to make sure that my heart is healthy enough. I consider this like cancer. I'll have it for the rest of my life. I'll be on medication for the rest of my life, and in the back of my head I'll always be worried if I'm going to suffer another life-threatening blood clot. Do yourself a favor, especially once you're over 40 years old. Get a doctor's visit once a year. It's fairly cheap and fairly easy to do compared to spending 6 days in ICU like I did, compared to getting sedated 4 times like I did for surgery and other tests. And I also got shocked twice with electroshock therapy to get my heart beating like it's supposed to. I would gladly go back and go to a doctor, pay the $50 or whatever it is for a regular checkup, and hate every single moment of it compared to what I have to go through now. Right? Atrial flutter is serious. It happens to more people than you think, and it kills more people than you think. So again, do yourself a favor. The older you get, see a doctor regularly.